Hello, everybody. Good morning. Thank you for joining our live webinar this morning to launch our new report on the mental health and income gap. I'm Helen Undy. I'm the Chief Executive of the Money and Mental Health Policy Institute. And over the last year, we've been running the Mental Health and Income Commission to try and explore why it is that people with mental health problems face such lower than average incomes. At the Money and Mental Health Policy Institute, we are a research organisation. We aim to explore all of the different aspects of how money affects our mental health, but also how our mental health affects the way that we earn money, the way we manage money, the way we spend it, and how we can avoid harm as a result. And that would not be complete without looking at the money that we earn, our income from benefits and other sources, and understanding the disparity that exists there between people with mental health problems and people without. We knew going into this piece of work that it was a big, complex area of policy covering everything from benefits to progression at work to recruitment and employment discrimination. And we felt that we couldn't do it on our own and we needed the support of some real experts, which is why we recruited the Income Commission, chaired by Chris Pond, one of our trustees at Money and Mental Health, who brings a wealth of experience from the sector, and including a really wide range of high profile and expert insights from HR, employment, from unions, from the world of mental health, from business, from policy. You'll be hearing from Paul Farmer, one of those commissioners, in a bit, as well as Sacha, who brings a wide range of experience from business as well as from the charity sector, looking at the world of more sustainable finance. And we also embed all of our research at Money and Mental Health in the true expertise of people with lived experience of mental health problems. We run a research community of 5,000 people who all have personal experience of mental health problems and who inputted into the work of the Commission at every stage, and whose voices and experiences you will hear throughout the research and throughout this webinar today. In fact, we'll be hearing from a member of that research community, Sarah, in a little bit. So today we're going to go through some of the key findings from the research. As ever at Money and Mental Health, we try and root our research in really practical policy suggestions. So we will be having a discussion about some of the policy ideas. Those are split between the urgent responses to the pandemic. COVID-19 has the potential to significantly exacerbate that mental health income gap, but also brings opportunities as new approaches to policymaking are being discussed. We've seen the government intervening to a greater extent than probably ever before in household finances, and also the issue of mental health and money rising up the political agenda. So we'll be discussing some of that as well. While we're having our discussion, we would really love to hear from you. It is strange doing events online, but it does have some benefits. The benefits are that we can be much more accessible and open. I'm so delighted that there's over 300 of you registered this morning, which is far more than we could normally fit into the kinds of rooms that we can hire for our events. But it does mean that I can't see you. So we would really love to hear your questions. Underneath the live stream box, you can see a link to click through and you can submit questions. Would really encourage you to do that early. Don't wait till the end of the event. There's a team beavering away in the background who are taking those questions and putting them through to our speakers. If you post them all in the last 5 minutes, then they're not so likely to be answered. So please do post them early as we start talking. You will also see a poll question in there. This is to prompt our discussion later and also to make sure that we capture a bit of a snapshot of your views. As I mentioned, the report covers a whole wide range of things. And actually, benefits and out of work support is a huge area that we will be discussing. But our poll question today focuses on the role of employers. And we want to know from you, what is the most important thing that you think employers can do to support people with mental health problems in work? There's 4 options for you there in your poll, and we'll be really interested to see what you think is the most important. Please do also feel free to tweet if you are so inclined. We will be live tweeting the event using the hashtag #ClosingTheGap. If you can manage that many screens at once, you're doing better than me. But I'd love to see the tweets afterwards. So we will definitely be looking through all of those. For questions on the link, please. Fantastic. I think that is all of the housekeeping introductions from me, in which case I'm going to hand over to Connor. So Connor Darcy is Head of Research and Policy at the Money and Mental Health Policy Institute. So he's responsible for planning and delivering our research programme. He is responsible for gathering all of those really important insights from the research and from our research community as well. Prior to working at Money and Mental Health, Connor worked for the Ministry of Housing, Communities and Local Government, and he spent most of his career in the third sector, including roles at the Resolution Foundation and the Joseph Rowntree Foundation. I think you should be able to see Connor's screen, so I will hand over to Connor. When Connor's finished speaking, I'll be giving those poll results, so please do vote while he is talking. Thanks very much.
Thanks, Helen. And I'm also having screen difficulties where I've put up my slides on this screen rather than this one. So I'm going to keep looking this way, but hopefully that won't be too much of a difficulty. So I'm going to echo Helen's comments around the commissioners and just say thank you so much to them. I'll let Chris and Paul talk a bit more about their experiences, but just to say that they've been fantastic throughout. So really appreciate their efforts on this one. So this cycle is core to what we talk about a lot at Money and Mental Health, how when we're having financial difficulties, that can lead to exacerbating our existing mental health problems or causing them in the first place, but also mental health problems can make it that much harder to kind of solve those problems, to reach out for help. And I think one of the reasons that we wanted to do this project so much is that while how firms behave, how how accessible debt advice is, can really determine how toxic this cycle becomes. What we found is that if you have a lower income, or if it's insecure or unstable, then it can just make all the consequences much worse, and can mean this cycle just becomes again that much more damaging for our mental health in the long term. So that's the reason why we wanted to go into this, and it's also the reason why the large mental health income gap that we found is so concerning. So I think we already expected there to be a sizable difference, but we were pretty shocked by the size of the gap where people with mental health problems, and that's from more common conditions like anxiety and depression right through to more severe mental illness. We found that there was this thousands of pounds difference per year. And just to focus in on that one group, people with anxiety and depression, common mental disorders, typically have incomes of £8,400 less per year than people without those conditions. So we're talking about really huge gaps. Now, obviously, the reason why those gaps are so concerning is what the consequences of them can be. And the pandemic, unfortunately, doesn't make any of this any easier. So some of the work that we did for our first report as part of this commission found that 2 in 5 people with experience of mental health problems had a drop in their household income due to the pandemic. So things like furlough or being made redundant. But what we found is that, really worrying signs of how that knock-on impact was affecting people's day-to-day living standards, where people, 1 in 3 of those who had that income hit were already cutting back on things like heating and food, and real core essentials that help us to stay healthy and well. So again, that lack of income, that lack of buffer or a kind of a safety net that a decent earnings can give you, just means that when things go wrong, as they will, you can end up in much more difficult situations quite quickly. So what's driven that gap has been a big focus for us. I think the 3 areas that we focused on are particularly around employment, wages, and the benefit system, which I'll talk about a bit more later. But I think it is important to say, and it was a real interesting discussion that we had with the Commission, that there are lots of other factors that influence this. So say access to mental health services, and the quality of them. If more people can get that support, it can help them to stay healthier so that these problems don't crop up. But we focused in on the ones where there was the most direct link to incomes. So as I said, employment, wages and benefits are big drivers. We found that people with mental health problems are less likely to be in work in the first place. Obviously, there's concerns around how the pandemic will play out and redundancies. But even at the peak of the labour market, when employment rates were really high in 2018 and 2019, there was still a 31 percentage point difference in the employment rates for people with mental health problems versus those without. So some really large and striking differences. When people with mental health problems were in work, they were more likely to be in lower paid and part-time roles. Part-time roles can be fantastic for your mental health and help you manage your health needs along with the need to work. But what we found too often was those part-time roles were often low paying and there weren't many quality options there. And we found that 1 in 3 people who have mental health problems and are in work were in some of the lowest paying occupations, as opposed to 1 in 4 for people who don't have mental health problems. So some really stark differences there. And both of those factors, the different employment rates and the lower wages, meant that people with mental health problems were more reliant on benefits, which have eroded in value over the years or stayed pretty stagnant. So some big factors there that have driven this. And I suppose digging into some of these specifics, and what we heard from our research community, who, as Helen mentioned, are at the core of all this research and have generated a lot of our ideas as well. The inflexibility and discrimination in the workplace was a big one. I think sometimes this is probably from a lack of knowledge and a lack of understanding, but sometimes it seemed to be more conscious policies. So this quote here on the left is from a member of our research community who asked for part-time hours or reduced hours rather than full-time to again help them have that balance between their working life and their health needs. But that was rejected, and it ended up with this deterioration in their health and a real negative cycle that meant that they weren't able to stay in work and now have been out of work for 7 years later. I think that's something that came up a lot, how small decisions and small difficulties could often lead to you losing your job, not being able to stay in work. And once you're out of work, it was that much harder to get back in. More broadly on discrimination, we did polling for this report where we found that 1 in 5 people with experience of mental health problems said they'd face discrimination in the workplace. So that might be things like not being given the chance in the first place. So recruitment policies, where we heard around employers focusing on gaps in employment history that might be down to periods when they were unwell. Similarly, it could be things around progression, not being seen as kind of your face fitting in terms of who gets promotion opportunities and who's considered. Insufficient support when unable to work was a big one, where, again, this particular example here on SSP, which is statutory sick pay, that it basically wasn't enough to help to cover the essential costs that people had when they weren't working. And that's, again, reinforcing this cycle, whereas the person says they're running up debts on credit cards, which is it's a big worry. And that also extends out into the benefit system as well. This person here had recently lost their job, and as they say, this was a real hitting home for them how insufficient that support was. But also, for people who are long-term reliant on benefits because of their mental health, the problems are much the same, but more entrenched, where it's just been a kind of a much extended period on what is often a very low income. So those are some of the key issues that we found. To address that, we came up with a package of recommendations. As we said earlier, there's other things that could have been discussed that maybe we'll come on to in the discussion, things around mental health services, things around what works for different groups, whether it's thinking about ethnicity or age or different levels of mental illness or mental health problems. But these are the ones that we focused on. So I think the pandemic shaped so much of the commission's work. Well, unusually, we didn't get to meet in person as you normally would for these sorts of processes. But we realized that there was a real risk that the large income gap that we found was only going to be made larger by the pandemic, especially with those concerns around discrimination and in the need for flexible work. But at the same time, if we just focused on that, we'd be missing the fact that these aren't new issues. These are long-standing problems that people with mental health problems are having to encounter. So we needed to tackle the kind of the deeper roots and some of the cultural issues that exist both in many workplaces, but also in the benefit system. So the recommendations are split into those immediate responses and those more systemic change focused. So the systemic change ones, where we'd absolutely like to see governments and employers act right away, but we recognize that they'll probably take a bit of time to really pay dividends. So picked out a few of the key ones. There's lots more in the report, so I'd encourage you to go and have a read. But for employers to have that immediate pandemic response, thinking around how staff can be supported while they're on furlough, whether that's recognizing that they've had an income drop, most people on furlough, and is there support or signposting that can be offered, but also when people come back into work, where it can be a real time of worry. And so polling that we've done again finds that people with mental health problems are that much more worried about returning back to normal in the workplace when COVID restrictions are lifted. So that would make a real difference. Mental health training alongside that, particularly for line managers, we think could make a really big difference, again, with an emphasis on the practical side of things. How does your mental health problem affect your ability to do your job? And then offering roles flexibly by default. So that's advertising when you're recruiting. It's offering it to people who might already be in full-time roles, but just being aware that more job design is a really important part of the puzzle for people with mental health problems. Employers are, for government rather, for the immediate response. Again, that flip side of the flexible work, we think that there should be, at least for the duration of the crisis, a right to flexible work to, again, help more people to stay in work, and recognizing the toll that the pandemic has taken on all of our mental health. Statutory sick pay, as we talked about, really isn't very much to live on. The UK is quite near the bottom of the table internationally, so raising and expanding the eligibility for that, and expanding the current uplift that's there for universal credit to people who are on legacy benefits, which is many people with mental health problems who haven't had that same uplift, and keeping the uplift for people on UC. The longer term, in thinking about that systemic change, something that came up a lot from our research community was how the softer elements of the workplace, the kind of cultural things again, where they were overlooked for opportunities, really meant a lot. But also, when you're getting back into work, that it could be really nerve-wracking and your mental health could be affected. So things like secondments, like shadowing, buddying opportunities were really popular amongst many members of our research community and relatively easy for employers to adopt. Maybe more of a stretching one is requiring all line managers to have practical mental health training. But again, for us, it kind of sits there as a health and safety issue almost, where people should understand how their work can affect our mental health, and simple steps that people can do to avoid some of the worst harms, and how to help people thrive. And I think that was another kind of key discussion point with our commission, where all of these things, while they do require something from employers, and employers have obviously had a tough time over the past year, there's opportunities there for them as well to help keep their workforce healthy and engaged and productive. And lastly, developing a list of reasonable adjustments, thinking about just having that list of what are the sorts of things that would make a big difference for people with mental health problems to thrive at work. And then finally, what can government do in the long term? We think there's probably some, those elements of discrimination that we found, where there's some important pay gaps and occupational differences. So requiring mandatory reporting of different pay levels by mental health problem, but also by whether firms are turning down or accepting flexible working would help people judge who's a good employer for people with mental health problems. The benefit system is obviously a really big part of this. As we said, the value of many benefits have dropped over time, or not kept pace with inflation. The reviewing the level and the kind of the scope of key benefits like employment and support allowance would offer that a bit of a boost to many people who are long-term unable to work. And DWP staff who are at the front line, and increasingly, as unfortunately it looks like there's going to be more redundancies in the months ahead, having that mental health awareness is really key, and that it should be practically informed. So those are some of the key recommendations. As I said, there's lots more. I'm happy to discuss some of them in more depth, but do go and have a read of the report on our website to find out more. That's it from me.
Fantastic. Thank you very much, Connor. That was a really good overview of the report. Do have a look at the full report on our website. I've been asked to remind you as well, for those who have clicked through on the live stream through to YouTube, the link to submit questions is back on our website underneath the screen. So you won't be able to find it very easily on YouTube, although I think it is in the comments. But if you go back onto our website, you can submit your questions in there. So we said that after Connor's presentation, I'd come back to the poll that we set you at the very beginning. And we've got really interesting results, actually. And I think, it's particularly interesting given what Connor was just saying about the reviews that had come through from our research committee when we were putting together the research. So we asked, what is the most important thing that employers can do to support people with mental health problems in work? And we gave you 4 options. The most popular of those options was, sorry, I'm reading off Zoom here, which is testing my multitasking, was developing a list of reasonable adjustments and proactively offering them to employees, and that was at 41%. That is very clearly the front runner here, followed by offering flexible working by default at 33%. Interesting that flexible working might be one of those reasonable adjustments, but might not be as well. So reasonable adjustments looking more broadly than flexible working is very popular. Mental health training for line managers, also popular at 22%, and lagging a long way behind is offering buddying opportunities to help people with their development at only 4%. I think what probably came through in the research with the research community as well, is that that was really popular. But if you had to pick just one thing, that on its own is not enough. So perhaps the way we've framed the question there has put that one right down at the bottom. But if we could only do one thing, it sounds like from this group, we'd be looking at better information about reasonable adjustments and proactively offering them. At the end of the panel discussion, I'm going to ask our panelists if they could take one of the recommendations from our report and make it happen tomorrow. Which one would it be? That's not just those focused on employers, but more wide-ranging as well. So I will plant that question there for our panelists to think about as we hand over to Sarah. So Sarah is a member of our research community. So that's the group of 5,000 people with experience of mental health problems who feed into all of our research. Sarah took part in the surveys and research that we did to feed into the Income Commission, and she's also volunteered to share her experiences today. So Sarah has experienced mental health problems from a young age, but she's also worked in the debt advice sector since 2006, and she has experience of the benefit system. So it gives her a really unique perspective on some of the challenges that we're exploring in the report and that other people with mental health problems are facing in navigating those systems. This is a pre-recorded interview. Sarah felt that would be a more comfortable way of sharing her experiences than doing it live. So I will hand over to that now, and then we will come to our panel to discuss it in a minute. Thanks very much. I think we might be having a few technical difficulties with the video there. So what I'm going to do is suggest that perhaps we move on to the panel discussion, and then we will come back to the video in just a minute when we're sure we've got the audio working. So I think we'd lost sound on that. So Chris, in that case, I'm going to come over to you first, if that's all right with you. So Chris Pond is the chair of the Lending Standards Board and also chair of our Mental Health and Income Commission. Chris has a wealth of experience gained through ministerial, chief executive, chair and director roles, covering a really wide range of organisations in the financial services industry, including statutory and voluntary regulation and consumer bodies. His current non-executive roles include chair of both the Money Charity and the Equity Release Council Standards Board, that's a mouthful, and is Vice Chair of the Financial Inclusion Commission and a member of the Treasury Advisory Panel on FinTech. Chris is also a trustee of the Money and Mental Health Policy Institute. Chris, I'm going to hand over to you for your thoughts and reflections on the process and on the report itself.
Well, thanks very much, Helen. And we've heard a lot during this pandemic, haven't we, about a crisis of low incomes and debt, and also about a mental health crisis. And what this report highlights is the perfect storm of these two crises. And I really want to congratulate the team at Money and Mental Health Policy Institute, their hard work and expertise in preparing such an excellent report, and also to thank fellow commissioners who took time out of incredibly busy lives to lend their expertise and experience to this project. And as you'll have heard from Helen at the beginning, there was a wide range of expertise amongst the commissioners from the world of HR and trade unions, from the world of government policymakers, and representing different groups who are affected in this way. And I can't claim that we agreed on everything, but those recommendations that you've seen Connor present are those which we believe really do need to be considered seriously, both in terms of the immediate circumstances and also longer term systemic changes. But most of all, I want to thank members of the research community who have shared their experience in a way that underlines the urgent need for action by employers and by government. Now, when we embarked on this project almost a year ago, none of us were then aware of the way in which the vicious spiral of mental health and low incomes would be given an additional twist by the pandemic. Already, as we've heard, even those facing anxiety and depression, common problems in mental health, were living on an income little more than 2/3 of the average. And the pandemic has manifested itself in two ways: an increase in the numbers facing those mental health challenges, and a further drop in income for those affected. Nearly 2 in 5, as Connor has outlined, of those with mental health problems seeing their income drop further, leading many of them to go without basic essentials. Now, the report documents the moral case for action in a way that none of us can ignore, but it also shows there's a compelling business case for doing something both immediately to address the pandemic, but also to address those systemic issues. And as we try to build back better from this pandemic, we can't afford to waste the skills and talent of those locked out of economic activity, and nor can we ignore the potential for increased productivity of the workforce as a whole if we provide the support and flexibility needed to allow those with mental health challenges to contribute at the workplace or as self-employed. And I was really pleased, Helen, to see the responses to that poll, to see how much support there is for some of the measures that the report outlines. Now, I do commend the measures in the report, both those for urgent action and by employers and government, but also to challenge those systemic inequalities. The upside of all of this is that as more people find the mental health of themselves or those around them undermined by current circumstance, there is more understanding and more willingness, certainly, than during the last crisis in 2008, to give everyone the opportunity to contribute and build a better life for themselves and their families. So I'm hoping, Helen, this report will help to reinforce that trend, and that as far as mental health and income is concerned, building back better after the pandemic will be more than just a catchphrase. Thanks.
Thank you very much, Chris. And thank you again for your role chairing the Commission. I think it's fantastic that there's been such a diversity of views, and also that everybody has come up collectively with a set of recommendations that I think are really ambitious, and there's some exciting ones in there that are quite new and innovative thinking as well. We are going to go back to our video so we can hear from Sarah now. Please bear with us, but I think it should all be working fine. So back over to Sarah to share some of her personal experiences.
Hi Sarah, thanks for taking the time to talk to us today. We do appreciate it.
Hi.
Hi. I just wanted to talk to you a bit about your experiences of mental health and employment. And you've said to us that you've experienced mental health problems since a young age. Can you tell us a little bit about how that's impacted on your employment history?
Yeah, I think the first thing is that I get really, really tired really easily. And if I get overtired, I will fall into depression. So I find it really, really difficult to work full time. I think I had one full-time job when I was in my early 20s, and I really struggled with that. Since I had my kids, I've had another full-time job, but I only managed it for a month. And then I had to stop because it was making me really unwell, not just because of the full-time, but that was a big part of it. The other thing it's affected really is who I work for. And because I need quite a lot of support. I get quite anxious if I don't feel I can talk to a manager and so on. So I actually worked in mental health for quite a long time, and I tend to work for charities, and I would feel really quite nervous about going to work for a private company. I've not always heard good things from my friends about whether they're supportive for people with mental health problems. So it kind of limits the hours that I do and who I work for. And the other thing with that is that there aren't, in the kind of role that I do now, there's fewer and fewer part-time jobs. So I'm quite limited in the jobs that I can take, because a lot of them just want full-time. And I know if I try and do that, it will break me. So I can't do it.
Yeah. So it's a balancing act between sort of managing what you can do and kind of doing that part-time.
Absolutely. Yeah. And I think the other thing that has happened is that when I found a job where I did feel comfortable and I did feel supported, I found it very difficult to leave. And even though I kind of wanted to develop my career, there's this kind of anxiety around moving somewhere else, and will I get the same level of support? Will the kind of support package, as well as the actual personal support from managers and so on, will the actual kind of formal support they've got in place be as good? And that put me off moving for quite a long time.
Yeah. Okay, so what kind of support do you think employers could offer to make it easier for people with mental health problems in the workplace?
I think the first thing for me is being able to have open conversations with my line manager. I think where I've worked in mental health services, it's something I've got used to, because obviously they tend to be quite supportive because of the nature of what the work that we're doing. So I got in the habit of, whenever I start a new job, I make the point of saying to my line manager, look, these are the problems I have. This is what I need you to do. And I'm someone who, if I'm having a bad day, I go into a shutdown. I can't say anything and I'll try and struggle on. And what I need is someone to notice and say, are you okay? Do you need a 5-minute chat? And usually that 5-minute chat will really help, and it means I can get through the rest of the day, but I can't initiate that conversation. So I need managers to know that they need to come to me, and I do want to be approached. It's just that I can't do it myself. And just being able to have that conversation generally without fear of judgment, without fear of it causing problems with work or anything. So I think certainly from what I've heard from friends who've had some terrible experiences with their mental health in the workplace, managers just need some decent training as well to be able to have those kinds of conversations. Another thing that's really important for me is flexibility, so that if I need a bit of time off, or as I say, I get tired very easily. So if I need a bit of a rest during the day, I can do that, or pop out for half an hour to clear my head and go for a walk. And I think that's I've got like a mental health action plan for work that I can just say, right, I'm going for a walk, even if it's a time that I wouldn't normally. Contractual sick pay seems like a really obvious one, but I've worked in a job where I didn't have that. And what you end up doing is pushing yourself really hard to keep going beyond the point where you really, really needed a couple of days off to reset. And I think that can be a big trigger, certainly for me. If I push myself too hard for too long and don't take the time that I need early on, it will lead to a much bigger episode of depression further down the line, and actually end up having more time off. And the other thing this year I've had, because I was quite new to my role and it's quite a different type of role, I found myself a business mentor. And although she wasn't focused on my mental health, it was incredibly useful just having someone, a sounding board, helping me understand what my role was, addressing issues, which some things like, I was finding big meetings really scary and quite anxiety inducing, and she really helped me with that. And I do think that having someone outside of the organisation, some kind of mentor or buddy system or something like that you could talk to and work through problems, might really help people with confidence, particularly if they've been out of work for a little while as well. It's kind of having that extra support and sounding board without any fear of you saying something that's going to get you into trouble with management or your colleagues or anything like that. And that was incredibly useful, actually. And I'd love to see that as a kind of support measure for people with mental health problems more generally.
Yeah. So it sounds really like it's been really helpful for you.
She was brilliant.
Yeah. So thinking a little bit about sort of beyond work and thinking about other sources of income and benefits, you said that you've been in receipt of various benefits over the years, and universal credit being one of those. How have you found the universal credit support and the adequacy of it?
I get UC. I'm renting, I've got 2 kids, so I get a top up of UC. I'm very conscious that one goes to uni in 6 months and the other one next year, and most of that is going to stop, and I'm actually going to really struggle on the income that I've got. I don't want to move house because my kids need somewhere to come back to in the summer holidays. And actually it's really hard to find property around here anyway, but it's going to be difficult financially for me. And I can't up my hours, so I have to try and look for a job that pays more, but it's hard to find part-time jobs for the type of role that I do. So I feel I'm in a bit of a catch-22, really. I do also get PIP, but they didn't give me any points for my mental health problems, even though they were quite severe at the time. And I found the application process so stressful that I don't think I'm going to go through it again when I have to reapply. It really knocked me for 6 doing that. So yeah, it's kind of there on paper, the support, but it's the amount is too low, and there's not really any support from the benefits agencies to help you with work or anything like that. They just give you a little bit of money. And I know in the past you could get help from the job centre actually looking for work and finding your way into work, and they don't do that anymore. If you're in work, they're not interested. So yeah, I've had quite a lot of problems with the benefit system over the years, and it tends to cause more stress than it solves overall.
Yeah, okay. Thank you. Sarah, thank you so much for taking the time to talk to us today. We really appreciate it. Thank you.
Thank you.
Thanks very much to Sarah and to Nikki there for speaking to Sarah. Nikki's one of our report authors, so huge thank you to her as well. Sarah's experiences clearly resonate with a lot of the issues that are raised in the report, and we'll be discussing some of those more in a minute. I'm going to hand over now to Paul Farmer. So Paul has been Chief Executive of Mind, the leading mental health charity working in England and Wales since May 2006. Paul is chair of the NHS England Independent Oversight and Advisory Group, which brings together health and care leaders and experts to oversee the current mental health long-term plan for the NHS in England. And importantly, Paul also co-authored Thriving at Work for the government, which is an independent review setting out how to transform mental health in workplaces. Paul, thank you for your work on the Commission. It's been hugely appreciated, and over to you for your thoughts now.
Thanks so much, Helen, and hello everyone. It's really good to be here, and thank you for asking me to speak at this really important launch. One of the things I really love about the work of this Commission and the report is the fact that at its heart, as you've just heard from Sarah, it's really listened to the experiences of people with mental health problems. And too often we tend to look at this issue through the lens of just the lens of employers, or just the lens of the welfare system, or indeed just the lens of the actions and supports of that the NHS can provide. So it's been really good to see this Commission take a much more holistic view, a kind of 360-degree view of people's experiences, of that journey that people go through, as you've heard from Sarah, which is not always a linear journey between being in work and actually thriving and contributing hugely to workplaces, being in work but not being well enough to be able to contribute, either appearing to be there but often not really being well enough, or indeed being unwell and not in work and receiving some kind of sick pay support, or finally being unwell, having lost your job, and then relying on welfare benefits to receive the kind of level of income that you need to survive. And of course, the figure that we unearthed when we ran the Thriving at Work review was that something like 300,000 people every year with a mental health problem fall out of work. And this, of course, is in a pre-COVID setting a couple of years ago now. And that's an enormous number of people. And behind every one of behind that number lie people's lives, which are at best perhaps just disrupted, but at worst ruined. And I think it's such an important moment for us to think about what we can do in the course of the next few months to make those experiences better for people, because as both Chris and Connor have rightly pointed out, we're entering into a period of real fragility, with some of the support about to disappear in terms of programs like the furlough scheme, and also some real fragility when it comes to the overall economy. And if we learn anything from previous economic cycles, it's that people with mental health problems often suffer worse than the rest of the population. So there is both there was an important issue to address before COVID, and the Commission was absolutely right to set its sights on it. But there is now an even more important reason why these recommendations should be taken seriously and acted on. And I particularly wanted to pull out 2 or 3 themes from the report that I think are really key. And of course, first of all, you've heard from Connor that frightening mental health income gap figure. The reality of that for so many people is walking a tightrope in terms of being able to access food, basic essentials, feeling confident about having a roof over your head, and indeed being able to build and improve your mental health through taking part in activities that you know are beneficial for your mental health. And we know that during the coronavirus period, that stress has been even greater, has been exacerbated for people with mental health problems. Our survey of 16,000 people over the coronavirus, the first lockdown period, found that very large numbers of people had found their employment status had changed, and that that had an impact on their well-being, on their overall well-being. So 3/4 of people whose employment status had changed had a lower than average well-being status. So we know that that has an impact on how you feel, and that's particularly the effect and experience for people from Black, Asian and minority ethnic communities, who of course have been particularly affected by the pandemic. Secondly, I wanted to pull up that theme that a couple of people mentioned. In fact, Sarah mentioned it as well, about the level of statutory sick pay. And this is a really important recommendation, that the statutory sick pay system really doesn't work for people with mental health problems. You know, the current rate of just £95 a week, not available until your 4th day of sickness absence, risks forcing people into poverty, leaving people with an impossible choice between taking care of your mental health or being able to pay bills or buy food. So really important that the government pays attention to the recommendation about raising the overall level of SSP and paying it from day one of people's sickness absence, because we know how important that is in helping people stay in employment at what's often a very difficult time for people. Then the theme about improving the benefit system. Now, for far too long, people with mental health problems have, I think, been a kind of inconvenient truth in terms of the way that the benefit system is constructed and deployed. For many years at Mine, we've been campaigning for a better welfare benefit system, which really thinks about the needs of people with mental health problems. And sadly, far too many people still tell us that their experiences are not what they should be. But again, I think the recommendation in this report, particularly highlighting the impact of conditionality on claimants, and also the importance of making sure that there is a connection between universal credit and the other benefits that people receive, I think are really important recommendations. And then finally, about employers. Now, actually, I think there is some good news to report about the role of employers in this during this pandemic period. And we know that where employers have already addressed the issue of mental health amongst their workforce and are really thinking about this in a holistic, cultural way, as your first recommendation, as your poll findings suggest, then employers have really thought about how you support people's well-being and mental health during this crisis period. But as the report also highlights, there are still far too many employers who have not yet got to that starting line. And I think this is a really strong reminder to encourage more employers, not just to do the right thing by people with mental health problems, but actually because it makes business sense to do so. And I think the opportunity that many employers are seeing in terms of supporting the well-being of all their staff, but particularly those people who experience mental health problems, is increasingly being seen by large, medium and small employers. So I think there's a real opportunity to build on in the course of the next few months and years. And that, I do think, is my last point really here, Helen, is the opportunities to build. We do have an increased public awareness and understanding about mental health, but we now need to kind of turn that understanding and better attitudes around the issue of mental health and the experiences of people with mental health problems into real change for people, so that as we come out of this pandemic period, people with mental health problems are not left behind. Thanks very much.
Thank you, Paul. That was really helpful and some really important points for our discussion as well. Before we get into discussion, I'm going to hand over now to Sacha Romanovitch. Sacha leads Fair for All Finance to deliver on their mission, which is to increase the financial well-being of people in vulnerable circumstances by providing access to fair and affordable financial products and services. She has a background in driving purpose-led change in business through her previous roles as CEO at Grant Thornton and as the inaugural chair of Access Accountancy. She has really extensive experience of working with businesses, government and civil society, and is co-chair of the Inclusive Economy Partnership, who are looking at some of the issues, including mental health in the workplace, and the board of London and Partners, and a non-exec director at Leapfrog Investments. Sacha, over to you. There is so much experience that you can draw on here. I'm really interested to know which things in the report really stood out to you.
Brilliant, Helen. Thank you so much, and thank you for just everybody who was involved in the research and putting together such a comprehensive report. As I was reading it, I was reflecting on all the different aspects, like you say, as sort of across my working career, and also really playing on Paul's comments around, the current situation now presenting particular challenges. And as I was listening, I thought I might start with a metaphor, which then can lead into some of the things in the report and actually practically what I've used as an employer that I think has made a real difference to people. So one of the metaphors I use at the moment is we're all, many of us are sat at our laptops all day, and I'm sure you've all had the fan of doom when your laptop fan starts whirring at such a pace and everything grinds to a snail's pace and it all gets really difficult. And we know what's actually happening in our computers when that happens. It's the CPU capacity is overloaded. And typically, what do? We realise that we've got 20 different screens open, we've got all sorts of apps running, we've got things going on in the background that we probably hadn't really noticed. And usually what we have to do is just shut some of them down and sometimes close our computer and give it a reboot to let it work. And I think that metaphor is a really important one when we're thinking about our mental health. I think that in this process, I think that most of us will have had some struggles with our mental health through this crisis. My team say they're probably working at 70% of their normal capacity at the moment, just because of all the different stresses and strains. So we talk a lot about that in terms of, really thinking about what is the pressure that we're putting on our brains and what are things that we can do to actually notice that is what's happening and to be able to really cool things down. Really sort of take that pressure off. And I use that metaphor because I think that is quite important when you're actually looking at it from an employer perspective. When I looked at my time at Grant Thornton, I've certainly followed this through in Fair for All, and I think it has really important applicability across the workplace. Is this first bit, and I think this bit in the report around, line managers need to understand what they're looking for, but workplaces also really need to continue the work to destigmatize the conversation and to build understanding. And I think using metaphor and stories to actually say, look, this is normal. Just as if we overuse certain muscles, or we've got a sort of, for whatever reason, we've got a slightly weak arm, I've got a fractured wrist at the moment, there will be things that actually put stresses and challenges on us in ways where we need to adjust our work to accommodate that. We need to be able to think in that way about our mental health as well. One of the things that was brilliant at Grant Thornton was I had a fantastic leader who himself had gone through a nervous breakdown. And he did something incredibly bold and groundbreaking. He started a blog, Where's My Head At? And he shared his personal story. And for someone in a senior leadership position in our firm to say, I've had real struggles with my mental health. I still have real struggles with my mental health. And I'm telling you about it because I'm adapting and I have my ups and downs, but it's okay. The impact on that was viral within the business, with people suddenly thinking not only as it's okay to talk about it, but actually that you can actually do anything you want, whilst also handling mental health challenges. And actually the insights and empathy that come from your mental health challenges often actually make you a better relationship person in interacting with people, because mental health isn't something that happens to other people. Mental health is all around us. It's just not talked about. And I know this is blatantly obvious to everybody on the call, but I think for a lot of employers, that stigma in the workplace and building understanding and being able to have that conversation is really important. And it was in why I think the training is so important is one of the things we had to deal with was a lot of people felt their job was then they didn't want to initiate the conversation because they felt it was then their job to fix somebody. But it's nobody's job to fix anybody. And once we actually said, that's not your job. Your job is just to actually notice and create space, as Sarah was saying. And that actually noticing and creating space for a conversation, and also being able to, identify when might somebody need some expert help, and to have a mechanism in a business for someone to actually find a route to that expert help. That's what your job is. You're not expected to be the, the counsellor or the mental health person. And that was really important for us. I think the second thing I think that is really important is all about this building working policies that enable people. Now at Grant Thornton, right from, April 2007, we made the right to flexible working available to everybody. And that was on a fundamental belief that actually there is something wrong about our workplace that expects everybody to just have this like absolute full-on life, and that's detrimental to society and all sorts of things, but actually destigmatizing it again, that it's not sort of something special for these people who are a bit odd. This is actually a really productive and thoughtful way to create space for people to have full and rich lives with whatever's going on in their life. So having policies that actually, again, in their nature, destigmatizing. Paid sick leave, I just think it's really important. Think about that as an app that's wearing in someone's head that when they're ill, it's something that's taking up brain capacity of, oh my gosh, am I going to be okay? And the catastrophizing that can go with that can really spiral into mental health. As an employer, anything that you can do that can reduce uncertainty, create calm and confidence for your people, will enable them to really shine and be their brilliant selves. And so, there's a lot of talk about the business case. The business case is evident. As we started to do this work, our sickness rates went down, our employee satisfaction went up, our ratings in terms of people wanting to join us went up. All of those things, basically, if you have people who are able to shine, and you create that environment for them, it just makes a massive difference. And the final bit I'd say, and I think this is sort of in the report but is worth drawing out, is thinking about culture and working practices. If for a lot of people, and Sarah was talking about it, that there are working processes that can either alleviate anxiety or create anxiety. We set up something very simple based on Nancy Kline's Time to Think, where we had 10 rules that were up in every meeting room, the rules for getting the best from our time together. And they were all about how do we create the space for people to do their best thinking, of giving turns to people in the room, having agendas that went out in advance with the questions that we were going to ask, setting people up for success rather than people feeling they were having to fight to have their voice heard in meetings. And I think there are some really important things that we can think about. How do we build into the very culture and the very way we work practices that actually enable everybody's voice to come through, and to shift this mindset from, I'm accommodating people who are different, to everybody has their brilliance, and if we create the right environment, then we will allow them to shine. So I think those are probably my headlines. So I really think mental health training and really making sure we've got policies that remove uncertainty for people, I think those are just foundations. And I don't think that businesses should be outsourcing that to government to do. I think it's just responsible business practice. So a bit of politics, but there's my radical thought for the day.
Thank you, Sacha. Actually, Paul and I were saying at the beginning of this discussion that I think the biggest risk is that we all agree. So any controversial and radical thoughts, very welcome. And please do feel free to disagree with each other. And particularly when we get to the end and I want to know which one recommendation are you going to try and make happen tomorrow. I'm sure we won't all agree on that. We have had loads of questions coming in, which is fantastic. Please do keep them coming. Thank you to everyone who's put them in. We will get through as many as we can. Apologies if we don't get through all of them. I'm trying to group some of them because we have some themes coming up already. So to start with, I'm going to put a couple of questions to the panel on recruitment. Recruitment and employment opportunities. So we've had one really great question from Dan to start with, which asks about the extent to which some of these inequalities might start earlier than someone's employment journey. So if your mental health experiences affect your time at university, your ability to go to university, the qualifications that you achieve, is there anything that the Commission discussed that might be able to help with that? And a connected question that came in from Devon was around how do we reduce the reliance on employment references for people who might not have as wide networks as somebody else as a result of their mental health. So if we take those two together, I'd be really interested to get your reflections as employers and also for those who've been a member of the Commission. So perhaps to start with, I might come to you, Chris. Do you have any thoughts on what came up in the Commission's discussions or in your experience on those two questions?
Yes, and if I may, Helen, I'll throw in a third question that somebody raised, which was about the process of recruitment. Because in the way that we go, the normal way that employers recruit people really don't work if you're facing mental health challenges. So as a specific personal example, my daughter, who's on the autistic spectrum and has got learning difficulties, a little while ago was invited to an interview with a major pet retailer. When she arrived, she was being interviewed along with 9 other people at the same time. And of course, for somebody with those difficulties, that just was, she just sat in a corner and didn't contribute at all. And we have to help employers understand that they are losing the opportunity of taking on some people with real contributions to make through that nonsense. The other question about references, I thought was a really interesting one, which, to be honest, I don't think we discussed in the Commission, but is very relevant, because we've heard a big debate about internship and the way in which that can disadvantage people who don't have the same networks as everyone else to be able to get a foot in the door. And that is also true for references, of course. If you can get a referee who has got considerable standing in the community in which you wish to be working, that is going to give you a real advantage. But for many people who are working part-time or in insecure employment, who don't have the same networks, perhaps because of their mental health challenges, that is an added disadvantage which they face. And then finally, if I could address the issue about people starting their working lives with those disadvantages, then we have heard a lot recently about the pressures on young people through this pandemic, the way in which so many young people, whether at university or school, or entering the labour force for the first time, are facing very real challenges in terms of depression and anxiety from the uncertainty that they all face. And that is overlaid by the fact that they don't know what their prospects for employment are going to be. We heard the report from the Institute for Fiscal Studies during the week, suggesting that they would be facing over their lifetime, as a result of the reduction in education, a very considerable drop in lifetime earnings. And of course, many students will be carrying very considerable weight of debt, which will further reinforce the mental health challenges. So I think there are, those 3 questions are interlinked. We need to make sure that we provide ways of helping people into their first opportunity in work, and that when they're in work, we provide them with the support that they need. Many of those issues were discussed in the Commission, but in the time we had available, we didn't delve as deeply into some of them as we should. And I really appreciate the fact that people have raised them this morning so that we can look back at some of those issues and see if we need to do some more work.
Fantastic, thank you, Chris. Do any of our other panel want to come in on those 2 questions? So we're looking specifically at students, so mental health impacts quite early on in career or before your career, and references. I don't know if in your experience as employers, that's something that's come up or that you've been able to accommodate at all.
Helen, if just a quick comment on that, if I may. I mean, I suppose 2 points. I do think it's really important that we recognise that often if you have a mental health problem, particularly at school age, that your academic attainment is challenged. So, you know, and that does mean that often people with mental health problems can arrive, you know, with some real disadvantage in terms of coming to the workplace. And I think Chris's point about, you know, being, you know, it's in a way we've learned, increasingly organisations are thinking to learn about how we adapt, how we make sure we don't have any unconscious bias in our recruitment and selection around when it comes to issues around recruiting staff generally. And I think sometimes there may well be an unconscious bias around mental health as well as other issues, particularly around issues around race. So I think it's important that recruiters think about this. But I also think and of course there are legal protections for people around requests for reasonable adjustments, and both in interview processes and also, of course, once people arrive in workplaces. And I think sometimes people don't necessarily always think that reasonable adjustments apply to people with mental health problems, that people tend to think about this as being more about physical disability, but of course you're entitled to ask for a reasonable adjustment in interview. And you know, thinking about Chris's example, that would have been a perfectly reasonable thing for his daughter to have asked for, and an employer would have been required to do that. Now, sadly, I don't think we see enough of that, and I think that's one way that we need to empower people to understand what they're able to ask for.
Helen, if I can, I just add into that I think that there is an opportunity. You know, we know that there are some employers that actually do this really well and are very thoughtful about what they're doing. And I think the best way of actually getting change is actually showcasing those and actually giving people examples. Because I think the worst thing in any area in terms of inequality is putting the onus on the person who's disadvantaged by the system to have to ask people to change the system to accommodate them. I think that's the worst thing that we could actually expect of people. Whilst it's the ultimate remedy, I think the more that we can actually showcase, hey, here are things you can do. This is what great looks like. Have you thought about? Because I do think that, you know, when you talk to people, it's often that they're not trying to be awful or bad. They just haven't thought about it. And so, you know, I think that's where sort of the more we can share the things that, have you thought about this? And this is the way to do it. I think it then lets companies step forward and encouraging them to share that on their sites, so that people actually, the other thing I've noticed talking to young people is often there's the assumption that it's not okay, that it will be a problem. And so I think that's the onus on employers to actually showcase, hey, we are open. These are things that we do to make sure that this workplace will be a safe and fulfilling place for you. And anyone who's working in employer branding at the moment who isn't paying attention to that, frankly, isn't doing their job properly.
Thank you very much, Sacha. I'm going to go to a couple of questions now about the benefit side of things and support for people who are out of work, because we've had a few of those come in. Two quite specific ones that I'm going to put to Connor and Paul first, if that's all right, because I know, Connor, I'd be interested to know what has come out in the research on this, and Paul, I know Mind has done an awful lot of work on improving the benefit system for people with mental health problems. So the two questions that particularly came in so far have been, did the Commission look at the length of time between PIP reviews? And secondly, have we looked at training for DWP staff, and what change do we think is needed there? So Connor, shall we come to you first for what's come out of the research?
Sure. So those are both happily recommendations that we've made, suggestions around. So on the length of awards, obviously, this is going to vary because there's a huge range of people who have mental health problems and their conditions will vary as well. But something that has come up in so much of our work over the years has been the uncertainty and the fear that those reassessment processes can cause, where, you know, without feeling like much has changed in your circumstances, you can be at risk of having a very substantial drop in income overnight. So there's some really big risks there. So our recommendation has been that actually those awards are extended. It'll vary depending on different conditions, but you know, more awards that last for a year, 18 months, 2 years. I think there's also an important question, and it was something that again came up, where that doesn't mean that you're left on the shelf and ignored by any support systems, and that you're just seen as someone who's we don't need to touch for 2 years. I think ongoing support and thinking about, okay, we're not going to reassess you, but what are the sort of things that would be useful and start to be helpful, whether that might be training or other things that have that less of that kind of conditionality and sanctioning fear attached to it. I forgot what the other question was, Helen.
So the other question was about training for DWP staff on mental health.
That was it. So again, I think we've had some examples where when DWP staff have understood how mental health problems can affect you, how that shapes, you know, what sort of jobs you should be looking for, what sort of training you can go on. People have had, you know, really positive things to say. But I think what we found is that far too many aren't really getting that experience, where it's just the focus is on getting into any job first, rather than worrying about the quality of it. And as we've discussed, if it's not the right job for people, if it's going to end up again exacerbating their health condition or aggravating it, it's probably worse than no job at all. So having that increased knowledge, so that advisors who are trying to do their best for staff, for their customers or for the clients that they're working with, actually understand these are the sorts of things that might be challenging for this kind of person. These are the sorts of adaptations that we can make. These are the sorts of jobs that might be more appropriate. I think would make a really big difference, and came through again really strongly. So again, got a recommendation around that too.
Thank you, Connor. Paul, has Mind been looking at this at all?
Yes, it's a really, the kind of experience of people through the benefit system has been a very long running saga in terms of what we hear from people on a regular basis. And I think Connor's absolutely right that it's easy to underestimate the level of anxiety and fear that actually going through these processes create for people. And that's exacerbated by the threat of conditionality and sanctions. And when we're talking about when we're talking about supporting people whose lives are often very fragile in their construction for a whole variety of different reasons, these kind of events are really major events. And if they're not handled well, they can have very serious mental health consequences. So I think you have to get the balance right between having appropriate time length between reviews that means that it's realistic and meaningful. And I think a longer timeline is often makes more sense, particularly for those people with more serious mental health problems. And the experience that people have of those reviews has to be one which is supportive rather than feeling as though it's punitive. And far too many people have told us that it feels that it's punitive. Now, I think over the course of the last few years, Mind and many other charities have, lobbied the DWP for improvements in those processes, and I think we have seen in the numbers that those experiences have improved. And part of that has been that both DWP and some of the companies who deliver assessments on behalf of the DWP have embedded more mental health training and more mental health support in their staff teams. But I think we also still hear far too many cases of people for whom that experience isn't a good one, and too many uses of conditionality, and also I think unfortunately still too many decisions being overturned on appeal, and that, if you like, has got to be the true litmus test for the effectiveness of the system. That I think still round about two-thirds of appeals leads to an overturning of an original decision, and so that suggests that the system still isn't really quite working for people. But those recommendations in the review are absolutely the right recommendations: proportionality around review timing and further training for staff, because we all need more training all the time. We can't. I think just because we don't go and do one journey into mental health, that's probably going to be a very basic experience. We need to understand, the experiences of somebody with eating disorders, or somebody with depression, or somebody with schizophrenia. And I think we can now create that opportunity for that to happen.
Thank you very much, Paul. Chris, if I may, I wanted to come to you with a slightly broader question so somebody has posed a really wise question about how this interplays with wider health inequalities and the pandemic. So we know that during this pandemic, people with pre-existing health conditions have fared worse, people on low incomes have fared worse, people with both pre-existing health conditions and on low incomes are likely to be at particular risk. Has this review explored any of those links? Do you think the recommendations coming out of the pandemic take that into account and might leave us in a better place if this were to happen again?
Yes, certainly we had discussions on the Commission about the overlay of this particular inequality, this particular disadvantage on income and mental health, overlaid by other inequalities, particularly gender inequalities, the additional disadvantage that people from BAME communities will face who also have mental health challenges, and the wider that growing divide that we're seeing. The gap between those who are in comfortable circumstances and the rest generally. Now, all of those inequalities mean that there is an even more pressing need for us to take the building out of this pandemic as an opportunity to not only address the very specific inequalities that we've been talking about this morning, but thinking about it in the context of those broader inequalities between the rich and poor, between men and women, between BA and E communities, the LGBT issue, etc., and making sure that this is seen as an opportunity. Now, one of the things that really came home to me as being more optimistic was that as more people are confronted by the impact of those inequalities, there is perhaps a greater understanding, a greater empathy about those who are facing the real challenges. And perhaps as we emerge from this pandemic, we will see a change in public attitudes towards dealing with mental health issues, to dealing with the disadvantage that people face trying to move into employment and dealing with those wider inequalities. Now, I'm a hopeless optimist, and it may well be that the harsh reality of this pandemic makes people even harsher in their approaches to these things. But I think we have a real opportunity here. I think government and employers should grab it. And I think it's the responsibility of the rest of us in civil society to try and make sure they do.
Thanks, Chris. It's nice to have an optimistic note in there as well. There's not enough of that around at the moment. I'm going to ask a question to Paul and Sacha as two of the kind of people running organisations at the moment. And Sacha, actually first I wanted to come to you, thinking about your experience running a really large, complex organisation, at Grant Thornton in particular. A couple of our recommendations in the review are on reporting. So we have said, particularly for organisations of over 250 people, we should see reporting on the mental health pay gap and on requests for flexible working that are turned down. Somebody has posed a question over chat as well about whether we should also be reporting on discrimination cases. What's your view on reporting as a big employer in general? Does it work? Are those the right things to be reporting on?
I think I'm a great fan of reporting from a transparency perspective. I think the important thing, I think, is, you know, it's fascinating when you look at the transparency agenda that a lot of large organisations are very happy to be transparent when they've got data to publish that makes them look good, but deeply uncomfortable about publishing data that makes them look bad. And I think that the way that I found through it was actually sort of saying, look, you know, the point is that we're wanting to shine a light on something where all of us know we've got to do better. So let's shine a light. The starting point is saying, well, where are we on this journey? And being able to actually sort of put it into a context of, right, we kind of need to know where we are. You know, what's the issue? Do we even collect the data is often the starting point. I think that one of the true but depressing things is I think there's an often assumption that big organisations have got these beautifully perfect data pools. And certainly when I was doing the work on social mobility and asking people to disclose, one of the starting points was, oh, hang on a minute, we don't really collect that data, and we certainly haven't got it in a way that's easy to cut it and slice it and dice it. And so actually some of the work on social mobility was actually working with people to find out, right, who's actually cracked or got a good way of collecting this data in a way that builds trust with employees. Employees often have deep suspicion. Well, why do you want to know this? People often don't disclose. So I think starting with, have you created an environment of trust to collect the data, having a collaborative group of people that can actually almost show organisations, how do you do this? And then actually building out that pathway to then, with that data, to be able to say, oh, so what does this show us? And importantly, to say, and so what as a result? And I think that having that really clear pathway is something that would be a really good collaborative piece of work to be done by key employers. That was incredibly effective on the social mobility side. We've seen it on women on boards. And I do think shining a light on things really, really does matter. I think it's also, you know, in terms of what data you disclose, I think it's, you know, I always had the report, certainly in terms of flexible working requests, that was an easy one to see so that I could just make sure that those were always being processed. I didn't have data on a mental health income gap. So I think there is something there to be able to say, what are things that could indicate there might be a story here, there might be something more we need to understand. I think that's what's really, really helpful. And I think the guidance from the Money and Mental Health Institute on that as to, here are some things of stones you might want to look under. is incredibly helpful for employers to be thoughtful. But I think collaborating with some key employers to actually get them to work together to help people to do this would be a really productive route forward.
That's a great idea. Thank you, Sacha. And we might come back to you on that one afterwards. And it's really good to hear that you think the recommendations are in roughly the right place as well. Paul, I wanted to come to you on the issue of flexible working. We've had a really good question about what does flexible working look like for people in shops and the service industry? It's really easy to default to thinking about people in offices. And I wanted to come to you on that, both because I know this is something that was discussed during Thriving at Work and that you put a lot of effort into exploring, but also we were chatting at the beginning of this call about Mind's extensive network of charity shops. And I think people often forget that as a chief executive of a large charity, you do actually have a significant retail workforce of your own. So I would love to hear your thoughts on that one.
Yeah, thanks, Helen. The retail team are just an amazing bunch of people who, of course, at the moment are all very sadly not working because our shops are very much closed, and they're both as staff and volunteers are very much looking forward to coming back. And I think the work that we do as a charity, as a retailer, and with several thousand staff and volunteers across the country, many of whom have their own lived experience of mental health problems, require us to think about this question of flexible working. But I think the principles are the same. The principles are around thinking about what the individual needs and wants to do. And I think one of the really interesting conversations we've had in the Commission has been about this relationship between flexible working and the benefit, the pros and cons of that, whether that's the choice that people can make to actually work for a number of different employers. Some people would see that as a real problem, but for some people that works for their particular circumstances that they're in. But in those questions, you always have to be clear about where can you access your mental health support when you're not well. And just because you're only working for our organisation 7 hours a week, for example, which some of our retail staff do, does that mean you're somehow a lesser employee? Well, no, you're still entitled to exactly the same access to mental health help and support as you would be if you were working full time. So I think you have to be really clear about what's the support available for people, regardless of their kind of working hours. And I think also when we've thought about how do you support, how do you make that work in a setting where there are opening and closing requirements of shops, for example, that's where we've seen things like job shares work incredibly well, where we've seen kind of people choosing to do part-time hours because some people have childcare responsibilities, but actually other people choosing to do part-time hours because they're doing a different job which stops at midday, say, and so they want to do the afternoon or the evening shift. And I think we have seen employers increasingly being able to offer that kind of flexibility of work. But I think sometimes what's missing is the clarity about the overarching, your entitlement to support for your mental health, whether it's access to an employee assistance program or indeed, the issues that we talked about here around sick leave, holiday pay, those kinds of entitlements. I think that's quite an important part of what good quality flexible working looks like for organizations. And so you can make it work. I don't think we should be. I think we should recognise that this isn't always easy, and it's not always easy for the individual, and it's often not easy for the employer. There does have to be some element of how you build that. That comes back to Sacha's broader point about how you build the culture within an organisation, about your overall commitment to your people. If somebody feels as though they're not really valued because they're a part-time junior member of staff, then they won't engage with you as an employer, and you create this gulf between the workforce and the employee. And I think one of the things we've really seen recently, our retail staff are a great example. We've wanted to really keep in touch with them, even though they've not been around. And I think that that commitment to that workforce group, including the choice we made to top up their furlough payments, is one that I think they've really appreciated. It says that you might not be physically working at the moment, but you're still very much part of the Mind family. And those are the I think we've seen lots of employers do that kind of what I call compassionate leadership when it comes to thinking about their people. And I would really hope that as we come out of the pandemic, that will show its benefits in terms of the way that staff members respond back in turn.
Thank you, Paul. That's really great to hear. And that point about keeping in touch with people when they're on furlough and supporting people back into work is absolutely vital. And that's one of the key things that came out of the report for me, actually, that I found particularly interesting was there are a lot of people who are really anxious about life returning to normal. We're all really excited about the vaccines and everybody's, wanting to be able to get out and see loved ones again. But actually, for many people, this pandemic has brought flexibility that they previously weren't able to get and has left some people quite far from the workplace in a way that can be quite difficult to come back to. So absolutely vital there. We've got 10 minutes left and I want to make sure that I'm a good chair and we wrap up on time. So I'm going to go to each of our panel members now to ask you all if you could pick one of the recommendations from this report and make it happen tomorrow, which one would it be? I'm also interested to know whether you think there's any particular political appetite or obstacles that we need to overcome. We'd love your ideas on that, but particularly any one recommendation. And we'd love to hear some disagreement. So feel free to, poo-poo everyone else's ideas and explain why yours is the best one. And I'm going to be particularly unkind by starting with Connor. So Connor wrote the report, so I'm asking him to choose between his children here. But I did warn him that I'm going to do it. So Connor, you can have one of these recommendations and make it happen tomorrow. Where are you going to land?
They're obviously all great. I think I would probably go for the one around mandatory mental health training for managers, where it is one that just makes such a difference in from a number of different angles. So from a kind of a preventative angle, where people's mental health, if you have a good relationship with your manager, if they're not putting you under undue pressure, if they're helping you on a day-to-day basis, that just helps you to stay healthy and prevent problems from cropping up. But when you're also experiencing a mental health problem, it again is, as we heard, I think from Sarah and from others, if you're able to have that conversation, if it feels open and you're not feeling like you're hiding a really important part of your life, it just helps you to do your job much better. So I think there's questions over what the training would look like, and I know this, as we kind of touched on, going on a half-day course once every 5 years isn't going to be enough. There's going to have to be a toolkit, and that's why I think it, not to go away from the question, but I think it works really well in tandem with some of the other ideas around that list of reasonable adjustments and thinking about what can be done. But I think that would make a really big difference and was hugely popular with our research community as well.
Thanks, Connor, and well done on sneaking a second recommendation in there as well. Chris, I'm going to come to you next as Chair of the Commission. I know all of these recommendations have been hard fought for to go in here, but where would you land? And why is Connor wrong?
Connor's not wrong on anything at all. He did a superb job, and I'd vote for all the recommendations, but you allowed him 2, so I'm going to have 2. I'd like to have all of them, but I'm going to have 2 as well. And the first of those is that nobody expected this pandemic was going to go on as long as it has. It's absolutely essential that we get some commitment now to continue with the support that the government has given, and all credit to the way that the government and the Treasury has stepped in to support people. But we cannot snatch away that enhancement of universal credit and the other benefits abruptly. That's like trying to teach people to fly by pushing them off the roofs of buildings, and it isn't going to work. And with furlough as well, it's been expensive, but it has been a lifeline for so many people. And great to hear the way that Paul talked about the way that Mind is topping up the furlough. But we have to see continued support. So when the Chancellor stands up in exactly a month's time, I'm hoping we will see an extension of those things. And then slipping in my second one, we've had from Paul the discussion about the need for flexibility in work. One of our other commissioners was Matthew Taylor, who did that really important piece of that report on the gig economy. And so many people facing mental health challenges are forced into the gig economy. And it's not because they want or need the flexibility, it's because it's the only jobs that are available. So we do have to find a balance there, that where people are working flexibly, and that is beneficial to them in terms of their mental health problems, that is also their choice and not the choice of employers. But I absolutely do agree. I'm not going to disagree with Sacha or Paul at all, that there is a real willingness by employers to address these issues. We just have to make sure that they have the ability to do so, the understanding, that line managers have the training and the understanding of what is necessary to make sure that people can make their real contribution.
Thank you very much, Chris. Sacha, I'm going to come to you next. No pressure to pick two, by the way.
Well, I'll probably sort of do it in terms of, what is the thing that would make the most immediate difference in terms of those apps that we're talking about being open, and I'm going to cheat in that I'm going to say anything that can be done to give more income certainty to people under challenges. And I think that's both for employers in actually, just paying people properly for sick leave. I think we heard really compellingly from Sarah, is that without that, people work longer, get sicker, and then you've got a much bigger, longer term problem. It's just a stupid business decision apart from anything else. So that in terms of short term, I think is something that's really important when we're thinking about what's frying people's brains. My longer term one, I absolutely agree with Connor. I think it's actually the mandatory mental health training. But I think that there's probably something that you want to play about in terms of wording and language, because often when people hear that, they receive it as, oh gosh, now I'm expected to be a counsellor and able to be an expert mental health person alongside all of my other job, versus positioning it as a triage of somebody who is able to notice and spot and has got a place where they can refer things onto. So I think that's maybe something we can sort of think about is for employers. Don't just do the training in isolation. If you've got nowhere to triage stuff to, you're likely just to create a whole load of other people with actual real mental health stress because they're now trying to do something that really is not their job. So always complicated, Helen, but hopefully that sort of answers the question.
It does. Thank you, Sacha. And Paul, coming to you in the final few minutes of our chat today.
Well, you got to 12:27. We all agree violently, which is quite an achievement. I'm afraid I don't agree with Connor on the mental health training, as we've discussed in the commission. Because actually, I think, as Sacha said, the issue here for employers is about the holistic view that employers take to supporting the mental health of all their people. And yes, training is, don't get me wrong, training is actually, of course, very important. But in and of itself, I think our discovery is that it's rarely sufficient. It needs to be accompanied by all the extra wraparound support that employers need to put in place. However, that wasn't my recommendation I was going to pick. I was going to pick the SSP one because I think as colleagues have said, this re-entry phase is going to be so tricky, both for individuals and also for employers. Really hard. There's going to be some very, very difficult decisions for employers to make about whether you're going to reduce your staff numbers, what you're going to do, what benefits you might choose to cut because they're costing you money. And I think the government's the safety net that statutory sick pay provides is going to be really important. Lots of employers, particularly smaller employers, don't have the capability to offer their staff significant additional sickness benefits. So they rely on SSP as that safety net. And at the moment, that safety net is far too low down. It's far too low down. And this, as you heard from Sarah, that's almost not a safety net at all. It basically just simply becomes it just stops you from falling completely to ground. And I think if the government raise that overall level, I think that could make quite a big difference to people feeling more secure. They'll be able to come back to take that time off for their mental health and come back well. Otherwise, we'll see a huge explosion of presenteeism, and suboptimal working, and that's no good for anybody.
Thank you, Paul, and thanks for getting a disagreement in the final few minutes. That was really fascinating discussion, and thank you to everybody who posted questions. Sorry that we didn't get through all of them, but I think by grouping them we managed to cover most of the major themes that came up in there. I just wanted to wrap up by saying an enormous thanks, firstly to our commission, to Chris and Paul, but all the other members of the commission as well, who contributed real-time expertise and insight into this, and it would not be the report that it is without that expertise, so we're hugely grateful. To our research community, to Sarah and everyone else who shared their experiences to feed into this work. We couldn't do it without you, and if you do take a look at the report, you will see those stories weaved throughout it. I want to say an enormous thank you to Connor and to Nikki Bond as well. Connor and Nikki did all of the hard legwork writing this report and drafting and making sure that we had all of the commissioner's bright ideas in there and all of the evidence as well. So thank you, I'm enormously grateful. And also to Sacha for your time today and all of your input, and Brian and Katrina for organising today, and to our team for organising this event. You will be able to watch back on this stream. It will be recorded and available on our website. If you've enjoyed taking part in the discussion, I would recommend joining our professional network. So we email our professional network every month with links to events and our latest research. It's people from a really wide range of professions, but if you've been interested in this event, there'll be things in there that will interest you too. And a final little plug, if you are an employer, we have produced a new best practice checklist for employers with a summary of the things that you can do off the back of this piece of research that you can find on our website as well. Thank you for coming and taking part, and I hope that we will see you at one of our other events soon. Thanks very much.